Welcome to our chemotherapy education class. My name is Mary Rohde. I'm an oncology certified registered nurse and also the clinical operation manager for Lake Health University Hospitals Seidman Cancer Center. The purpose of this session is to provide you with important information about chemotherapy, side effects, and how to manage them. Our goal is to provide you the best quality of life possible during the course of your cancer treatment. Our team at Lake Health University Hospitals Seidman Cancer Center is dedicated to you. You are the reason we are here. You will learn more about the team and how we work together today. Lake Health University Hospitals Seidman Cancer Center is an affiliation with Lake Health and University Hospitals Seidman Cancer Center. Our chemotherapy orders are the same as those at the Seidman Cancer Center. Our oncologists are University Hospital oncologists, and Lake Health completes all of our daily laboratory values in about 15 to 20 minutes so that you, our patient, can be treated in a safe and efficient manner without having to wait for long periods of times for those results. The management of chemotherapy side effects has come a long way in recent years. In fact, most side effects are temporary, controllable, and often preventable with prompt communication between you and your physician or nurse. It is very important for you to communicate what is happening to you. In your folder are several pieces of paper. The red sheet lists the issues you should call the nurse line, listed on the Lake Health University Hospital Seidman Cancer Center staff sheet, in order to get prompt treatment for these symptoms. We will be reviewing each of these as we go through the presentation. The yellow sheet is instructions on what to do the day before your chemotherapy treatment and the day of your chemotherapy treatment. You will also find the University Hospitals Seidman Cancer Center patient information sheets. These sheets are numbered and will be referred to as we progress through the presentation. They give you additional information on the topic and is the same information given to patients who travel downtown to the Seidman Cancer Center. Your healthcare team is made up of many different team members. There are the physicians and their nurse partner. This is your oncologist and the nurse who works with him or her. On the staff list in your folder, you will see the name of the physician as well as the name of the nurse who works with that physician. We are also very fortunate to have an advanced practice clinical nurse specialist in palliative care, Carol Matthews, who works very closely with the physicians and nurses to assist in symptom management as some of our patients progress through treatment. In the infusion center are the treatment nurses. These are the nurses who will be taking care of you during your chemotherapy treatment. You will also find their names on the staff list in front of the book. We make every effort to ensure you have the same nurse each time you come in for an infusion. In this way, you will get to know them, but more importantly, they get to know you. This is an important piece of creating the nurse-patient relationship. There are many support staff who are important to your care. These are the secretaries, the medical assistants, our social worker, the pharmacist, dietitian, and our volunteers. The most important member of this team is you, our patient. We encourage you to ask questions and communicate any concerns you may have. You are the reason we are here today. Be an active partner in your care. It is a good idea to bring a notebook to every appointment. Use this book to write down any questions you may think of between appointments. More importantly, write down the answers you receive. This may be helpful to you in the future when you think back and say to yourself, "Did I ask the doctor about?" Look back and refresh your memory. Report any side effects you may be having. Each time you come in for a chemotherapy infusion, your nurse will ask you specific questions about how you are doing in respect to your appetite, moods, sensations, pain, swelling, hearing, and a few more. These are to help us assess how you are tolerating your treatments. Don't be afraid to tell the nurse exactly what is going on with you. We are here to help you through the chemotherapy. Know your insurance benefits. If you are unsure what your insurance will cover, call the insurance company. If you are still unsure, call our billing department. They will assist you through the process. Keep a calendar of all your appointments and bring it with you each time you see the physician. We will be making appointments at that time. This is also helpful so that if you have a special event you would like to work around, you can discuss this at the time so your treatments can be scheduled with your daily life in mind. In the folder, you will find a card to use for updating your medication list. Please ensure you have a current list of the medications with you when you come for your appointments. You will be asked to verify your current medications each time you are here. It is important to know of any changes that occur from one appointment to the next. We will review this further later in the presentation. As I stated previously, there is a medication card in your folder. Please take the time to complete this if you do not currently have a medication card to put in your purse or wallet. It is important to always have an up-to-date medication list, not only for here, but for every healthcare facility you go to. It is your responsibility to maintain an accurate list of your medications. We must rely on you to tell us what medications you are currently taking and why you are taking them. Keep in mind, this list is to include all medications prescribed to you by other physicians you see. This may be your primary care physician, your cardiologist, rheumatologist, gastroenterologist, or even your eye doctors. It should also include any medications you are taking that you purchased over the counter, such as a daily aspirin, a multivitamin, flaxseed oil, fish oil, or any other herbal supplement or vitamin, or even a mineral. Additionally, you will want to include the chemotherapy drug you will be getting. If you do not know the name of the chemotherapy drug, bring this card to your follow-up visit with your nurse and she will write it down for you on the card. It is also important for you to make any other physician aware of the chemotherapy drug you are taking when you visit them or are seen in an emergency room for any reason, not necessarily related to your cancer diagnosis. If you are at home and not able to take your medication, it is important for you to call us. What is cancer? Cancer is a term for diseases in which abnormal cells divide and grow without control. The abnormal, rapidly dividing cells replace normal cells. This causes genes to malfunction or cells have difficulty performing their function. An example of this would be lung cancer. As a tumor grows within the lung, it takes up space which is normally a place for air or oxygen to live in. This then does not allow the lung to expand and contract in the same way and decreases the amount of oxygen being circulated through your body, or it may be pushing against a bone and causing patients to experience pain. The top picture shows normal cell division. The damaged or abnormal cell is not able to repair itself and apoptosis or death happens to the cell. The bottom picture shows a damaged or cancer cell is able to rapidly reproduce itself. Not all cancers or their treatments are the same. A cancer diagnosis is named for the place in the body where the cancer first appeared or the primary site. When cancer starts in one place in the body and spreads to another part, this is called metastasis. The way this happens is that cancer cells travel through the blood vessels and lymph channels from one part of the body to another. One of the goals of chemotherapy is to prevent this from happening. Please note, men can also get breast cancer. No one knows for sure what causes cancer. The cause is probably a combination of factors: the environment, smoking, exposures to chemicals, and the sun or even a virus. Treatment plans are based on the type of cancer and the stage of the disease. Some examples of surgery types are a lumpectomy for breast cancer, a lobectomy for lung cancer, and a partial resection for colon cancer. Surgery is an operation to remove the cancer or to find out if cancer is present and is considered a localized treatment, meaning you receive treatment at the location of the cancer. Chemotherapy travels through the bloodstream, reaching and affecting cells all over the body or through your entire system. Therefore, chemotherapy is considered a systemic treatment. Radiation is used to shrink tumors, or the area that a tumor was present, so it is considered a localized treatment, since again it treats only one location. You may have one or a combination of these treatments. Other types of treatments are hormone therapy, which adds, blocks, or removes hormones to slow or stop the growth of certain cancers. Chemotherapy and biological, also called immune therapy, are both treatments that fight cancer. Chemotherapy fights the cancer cells directly, and biological therapy uses your own immune system to fight the cancer. An example of a biologic therapy is interferon, used to treat a variety of conditions. Your treatment nurse can answer specific questions for you about these therapies as needed. Targeted therapy is a newer form of treatment for cancer. Its goal is to target a specific cell. A type of targeted therapy is a monoclonal antibody. Some examples of this would be a drug called Herceptin, which is used for breast cancer, and Rituxan, which is used for lymphoma patients. Supportive therapies are used to control or lessen side effects from the chemotherapy. Some examples would be the anti-nausea medications, which are given to you before each treatment intravenously. You may receive Benadryl as well to help lessen side effects of some of the other chemotherapy drugs. Your treatment plan may include injections such as Neulasta, Procrit, or Aranesp on the day of, after, or during the weeks between your treatments. These injections are part of supporting your own body's ability to make red and white blood cells. This is done to decrease or lessen some side effects. Clinical trials are research protocols that are used to find new treatments for various cancers, to improve the treatments that we already have, and to learn more about your cancer. All of the treatments that we have for cancer today are the result of clinical research that has been conducted through trials. In the past 10 years, cancer treatments have made great strides in improving treatments and side effect management because of these trials. We are fortunate to be part of the Case Comprehensive Cancer Center that has discovered new drugs and helped identify many disease-specific therapies. Participation in a clinical trial is completely voluntary. If you are eligible to participate in a trial, our clinical trial research nurse would have spoken to you prior to today's lesson. What is chemotherapy? Chemotherapy is used to cure, control the spread, or relieve symptoms of cancer. Your chemotherapy treatment plan will be individualized to treat the type and stage of your cancer. It may be in the form of a pill or an intravenous infusion. It is given in time intervals called cycles depending on the treatment you are receiving. It may be once a week, once every 21 days, or a combination of days. Please know that you may not get every side effect discussed today. Your nurse will provide specific drug information when you receive your chemotherapy. How does chemotherapy work? Because they are growing at an abnormal rate, cancer cells are sensitive to chemotherapy. Drugs or combinations of drugs are given for their ability to kill cells during their different stages of growth. The fastest growing cells are your hair, the lining of your mouth, and your digestive tract. Therefore, these cells are most sensitive to chemotherapy and may cause side effects such as hair loss, mouth sores, diarrhea, and low blood counts. At this point, we are going to spend time talking about some side effects of treatment that you may experience and how to manage them. Many side effects can be lessened, some even can be prevented. Remember, if you are at home and experiencing some of the side effects, use this CD, the notes you may be taking, and the patient information sheets in your folder as a reference. When talking to your physician or nurse, they may use the word counts. Blood counts are a laboratory test, specifically a CBC or complete blood count. These lab values help us understand how the chemotherapy is affecting you and how we can manage or prevent some side effects. Fatigue, infection, and bleeding are side effects related to blood counts. It is important to understand the role of your blood counts in relationship to chemotherapy. White blood cells. After receiving chemotherapy, it is normal for your blood counts to go lower as the chemotherapy works to destroy cancer cells. Your body is continuously making white blood cells. As cells die, new ones are being made. This happens over a period of time. The effects of chemotherapy are not always immediate. You are going to hear the word nadir. The nadir period refers to the time when your white blood count is at its lowest. This period is usually 10 to 14 days after you received chemotherapy. It is the point at which the lowest blood cell count is reached. You can refer to PI sheet 435 of the cancer therapy, which refers to low white blood cells. What can you do to prevent an infection? Wash your hands for 15 seconds or more before eating and after using the bathroom. Another thing you can do is sing the birthday song while washing your hands. When the song is done, your hands are clean. Practice good personal hygiene. Take a daily shower and do good mouth care. Avoid sharing eating utensils or glasses. You may do everything right and still get an infection that may lead to treatment delay and/or hospitalization. Call your doctor if you have a temperature of 100.5 degrees that does not respond to Tylenol in a 24-hour period. Once again, refer to the low white blood cell count, PI 435. Anemia is the term used to describe a decrease in the hemoglobin and hematocrit, which indicates the tissues are not getting the oxygen they need because of low red blood cells. You may be able to tell when you are anemic by the way you feel. You may feel weak, dizzy, short of breath, tired. You may experience ringing in your ears or even a headache. Treatment might be that your doctor may recommend an injection of Aranesp, Procrit, or a blood transfusion if your counts are low. You can refer to PI sheet 440, which relates to low red blood cell counts. Things that you can do to help decrease symptoms of anemia. Make slower movements when changing positions to prevent dizziness. It is okay to take a nap. Ask others to do things that would take a lot of energy, like going to the store, watching the kids. It is important not to push yourself. Instead, pace yourself and know your limitations. You may have to spread out the things you would normally have done in one day to perhaps 2 or even 3 days. The biggest thing is not to be afraid to ask for help if you need it. Make sure you call your physician if you feel dizzy, short of breath, or your heart is pounding very rapidly. Platelets. The function of your platelets is to help blood clot and prevent bleeding. If your platelets are low, you may see an increase in bruising or little red specks under your skin that look like a rash but don't itch, called petechiae. We will monitor your platelets and expect them to decrease in number, but it is rare that a patient will require a transfusion of platelets. Platelets recover on their own in 7 to 21 days. If your platelet count is low, your chemo may be delayed. You can refer to PI sheet 434 relating to low platelet count. What can you do to decrease your risk of bleeding if your platelets are low? If you are currently taking any medication that thins the blood, such as a daily aspirin, Motrin or ibuprofen, Aleve or naproxen, heparin, Lovenox, or Coumadin, you will most likely be able to continue taking these medications. However, please check with your oncologist before continuing to take any of these medications while you are receiving chemotherapy. Many over-the-counter items contain aspirin, so please read all labels carefully. If you are not sure if an over-the-counter medication is safe to take, ask the pharmacist if it contains aspirin and/or call your doctor or your nurse. Avoid contact sports. Use a soft bristle toothbrush and switch to an electric razor until you have completed all of your chemotherapy treatments. Call your doctor for any unusual bleeding from your gums, nose. If there's blood in your urine or in your stool, call immediately. Managing common side effects for chemotherapy. At this point, we're going to spend time talking about some side effects of treatment that you may experience and how they can be managed. Many side effects can be lessened or even prevented. Remember to refer to your folder for more detailed information. What is fatigue? Fatigue is the most common side effect reported by patients and often the most distressing symptom associated with cancer therapy. Cancer fatigue is different from everyday life tiredness. Your nurse will ask you how your fatigue is when you come in for your infusion. If it is different from the last time you were here, make sure you can tell her how it is different. An example might be something like, last time you could walk around the block and now you can only walk halfway around the block. You can refer to PI sheet 441 on fatigue in your folder. Factors that influence fatigue. The exact cause of fatigue is not really known. There are many factors that definitely influence fatigue. If you have an increased stress in your life, in addition to receiving chemotherapy, it is only normal that your fatigue is increased. Fatigue may have a cumulative effect, meaning that with each chemotherapy treatment, fatigue may increase. It may increase if you are receiving chemotherapy and radiation at the same time. Fatigue may last several months after treatment is completed before you start to feel like you have more energy. What can you do to decrease fatigue? Exercise may seem like a strange thing to do when you're tired. However, studies have shown that exercise helps decrease the feeling of fatigue. A short walk around the outside of your home, or even around the largest room in your house a couple of times a day, can make a big difference in how tired you feel. You will be really surprised how just a little bit of light exercise can help reduce the feeling of fatigue. Pace yourself by spreading activities over the day, including short naps. Avoid late afternoon or long naps, though. Good nutrition with increased fluids will help restore your body and flush your organs. Meditation, prayer, yoga, guided imagery, and relaxation can help relieve fatigue. Even though you follow these tips, your fatigue may continue until after your treatments are completed. You can refer to PI 441 in your folder. Hair loss. Certain chemotherapy drugs can cause hair loss. It can range from the thinning of your hair to complete hair loss. Hair loss can be very emotional for patients and families. Our hair is what oftentimes identify us, especially women. Some patients may choose to cut their hair short or shave it off before it begins to fall out or fall out completely. Hair loss can include eyelashes, eyebrows, pubic hair, and nasal hair, or total body hair. Please know it is temporary and it will grow back. The texture and color may be different. Hair loss begins approximately 2 weeks after treatment, with regrowth in 3 to 5 months after therapy is completed. You can refer to PI sheet 432 on hair loss and replacement in your folder. Care of your scalp. Use a mild shampoo to clean your scalp, Johnson's Baby Shampoo or something similar. Avoid harsh brushing and hot heating instruments. While receiving chemotherapy, avoid perms and hair coloring. The hair follicle is damaged from the chemotherapy, and additional chemicals such as color and permanent will further damage that hair follicle. You may want to wear a wig or a scarf to protect your scalp. Use sunscreen with SPF of at least 15, and always wear a hat when you go outside. You may need a hair prosthesis prescription from your doctor for your insurance company to pay for a wig. Make sure you check with your insurance company. We also have a supply of donated wigs in a variety of styles and colors, which have been cleaned and styled by the students at Brown Aveda Institute. You are more than welcome to come in and see the selection we have. There is no charge for these wigs as they are all donated to us. Look Good, Feel Better is a one-time makeover program for women going through cancer treatments done in conjunction with the American Cancer Society. Leave feeling great and with a goodie bag. It's a lot of fun. Ask your nurse or our social worker if you are interested. Skin and nail changes. Chemotherapy affects your skin and nails. Your skin may become red, dry, itchy, or flaky. You may use lotions that do not contain alcohol. Some examples of these are Lubriderm, Cetaphil, or Neutrogena, which are found in most drugstores. The alcohol in other lotions usually may dry your skin further. Also, always remember to use sunscreen when you are outside. Again, we recommend an SPF of at least 15. Your skin is more sensitive to the sun rays while you are receiving chemotherapy. Warm showers may help soothe your skin, but make sure the water is not too hot. A good way to gauge water temperature is to see if you can see steam in your shower or bath. If you see steam, then the water is too hot. Avoid scratching or picking open sores, as this can increase your chance of infection. With some chemotherapy drugs, you may notice your nails may change color and texture. This is because chemotherapy affects your nails at the nail bed, which is the beginning of your nail growth. You may see a tinge of blue coloring to nails as well as ridges in your nails. It is important to keep your nails clean and filed. Nails harbor bacteria, especially artificial nails. Cuts, or the spread of bacteria from manicures, pedicures, while on treatment may increase your chance of infection. Therefore, we recommend patients not have manicures or pedicures while receiving chemotherapy. Mouth care. If possible, seek a dental examination before starting chemotherapy, and let your oncologist know when your last dental exam was performed or if you have an upcoming dental exam scheduled. Chemotherapy may cause sores in the mouth and throat. we recommend using a salt and baking soda rinse to decrease the chances of infection. Add a pinch of baking soda and a pinch of salt to a 16-ounce bottle of water. Rinse your mouth with this 4 to 5 times during the day. Sores can be very painful and a source of infection, so avoid rinses that contain alcohol like Listerine or any scope product. Make sure to read the labels. You may want to try Biotine, which can be found in most drugstores and is over the counter. You may need to eat soft foods at room temperatures, as foods at the extremes of hot or cold may cause some discomfort or even burning. If you see at any time a white patch or other sore in your mouth, it is very important to not try and scrape them off. This actually is a protective coating. If these are scratched off, you will then have an open sore. Call your physician with any mouth sores that are not resolving with good oral hygiene and/or your oral rinsing routine. You can refer to PI sheet 430 that is in your folder. What to do for a dry mouth? Dry mouth can be a problem for some patients. Increasing your fluid intake is the best way to combat this problem. Water is your best choice for hydration. Try carrying a water bottle with you during the day. Some other suggestions would be sucking on ice chips, popsicles, or even some hard candies. You will find lemon drops throughout our facility, which are there for our patients. Foods can be moistened with butter, gravy, or any other sauces you may prefer. If eating becomes a problem, please call your physician's office and/or ask to talk to our dietitian. Also, pick up a copy of Eating Hints. You can refer to MouthCare PI 430 for other suggestions. Managing GI or gastrointestinal tract side effects. Next, we will be speaking about the management of the GI tract. This will include nausea, vomiting, diarrhea, and constipation. There are 3 types of nausea and vomiting. Acute nausea occurs within a few minutes to several hours after receiving your chemotherapy treatment. Delayed nausea usually occurs 24 hours after chemotherapy and up to 6 days after treatment. Anticipatory nausea and/or vomiting generally occurs before the patients receive their chemotherapy. It is what is called a conditioned response. An example of this is when you feel nauseated the night before or when you're pulling up into the parking lot before treatment. You anticipate you are going to feel nauseated or you're going to vomit. Let us know if this is happening to you. There are medications, antiemetics, which we can prescribe that will lessen these effects. If you are at home and are nauseated and vomiting more than 4 times a day for 2 days and you have taken your anti-nausea medication, you need to call us. Anti-nausea drugs work best when used preventatively or at the first sign of nausea, so that vomiting could be prevented. Take it when you first feel that uneasy feeling in your stomach. If you wait too long, it will not have enough time to get into your system and you will either remain nauseated or you may then vomit. Things to do to help decrease nausea. Instead of eating 3 meals a day, try eating 6 smaller meals daily. Putting less food into your stomach more frequently generally helps decrease the sensation of being nauseated. Avoid foods that have strong smells, that are spicy, fatty, or highly salted. Your stomach may reject these quite easily. Try eating foods that are bland: rice, mashed potatoes, shakes, cottage cheese, or applesauce. You may also consider clear liquids such as Jell-O or broth. If you are drinking ginger ale, try stirring it to get the bubbles out before drinking it. Sometimes the bubbling will irritate your already irritated stomach. Everyone is different. Trial and error. Try to find what works best for you. Some people are able to use distraction or guided imagery to help them relieve their symptoms. You may have to try several different interventions before you find one that works for you. Talk to your nurse or dietitian if you continue to have problems. Diarrhea and/or constipation. Diarrhea is defined as 3 or more watery stools in a 24-hour period. Constipation is defined as 2 days without a bowel movement. Normal bowel function is what was normal for you before starting treatment. You may not have any change in bowel habits. However, we have included in the folder information on diarrhea and constipation in case you do. Causes of diarrhea and/or constipation are the chemotherapy medications, changes in your diet during treatment, a decrease in activity during your treatment, pain medications, and some of the anti-nausea medications you may be taking. Things you can do to help with diarrhea are decrease the fiber and roughage in your diet, avoid alcohol and caffeine as these can stimulate your bowel, eat foods at room temperature, avoid hot or cold foods or liquids as these may irritate your bowel further. Take over-the-counter Imodium. You can take 2 pills with the first episode of diarrhea and 1 pill with each subsequent episode, up to 8 pills in a 24-hour period. There is a reference sheet in your folder entitled How to Manage Diarrhea During Chemotherapy that has other helpful hints for you. If you have 4 or more loose, watery bowel movements per day for 2 days, and you have tried the Imodium and it's not working, please make sure to call us. You can also refer to PI 431 in your folder. Things to do to help decrease constipation. Patients should be aware that even if food intake is decreased, they should have a bowel movement regularly. Things you can do if you are constipated include increase your fluid intake, increase your activity as tolerated. Increase activities such as walking and light exercise. This may help to stimulate your bowel. Increase fiber and roughage. Prevent constipation. If you are taking medications for pain or nausea, talk to your nurse or physician about our laxative protocol, which is also in your folder. Call if you have not had a bowel movement in 3 days and you have tried the suggestions listed on the laxative protocol sheet. You can also refer to PI sheet 436. Nutrition during chemotherapy. Please feel free to contact our dietitian at any time during your treatment if you have any questions. Her contact information is on the Lake Health University Hospitals Seidman Cancer Center staff list in the front of your folder. You will be weighed each time you come in for chemotherapy. This helps us to assess your nutritional status. If your nurse feels you could use some assistance in your dietary needs, she may suggest you meet with our dietitian. Your nurse is a great resource. Make sure you ask her questions. It is very important to maintain your body weight during chemotherapy. You may have to rely on smaller, frequent meals, as we spoke about earlier, and you may have to alter your diet depending on symptoms you may be experiencing. You also need to make sure that you're taking in enough fluids. The average is 6 to 8 8-ounce glasses of decaffeinated beverages or foods that are liquid at room temperature per day. Fluids should be decaffeinated due to the fact that caffeine is a natural diuretic and will cause you to lose fluids when we want to maintain a healthy fluid balance. If you are taking nutritional supplements, please talk this over with our dietitian to ensure you are getting the correct balance of minerals, proteins, carbohydrates, and fats in your diet. Focus on protein-rich foods such as meats, fish, eggs, dairy, dried beans, nuts, and seeds. Please discuss with your healthcare team all of the vitamins, herbs, and supplements you are taking. We suggest you not take large doses of antioxidants. Taking mega or large doses of supplements considered to be antioxidants, such as those listed on the sheet, is not recommended because they may interfere with your therapy. The effects of the antioxidants are to build up cells, which may interfere with the effects of chemotherapy, which is breaking down cells. If you'd like to take a routine dose of supplement, please talk to your oncologist before starting anything new. Some herbal medications should not be taken with chemotherapy, as they too counteract the effects of the chemotherapy. Our next topic is managing other side effects from chemotherapy. This will include peripheral neuropathy, cognitive dysfunction, pain, sexuality, and coping. What is peripheral neuropathy? Sometimes anti-cancer drugs can cause problems with your body's nerves. One example of a condition affecting the nervous system is peripheral neuropathy. This is a burning, tingling, numbing, or sometimes painful feeling in your fingers and hands and/or your toes and your feet. Peripheral neuropathy can sometimes cause changes in sensation of pain, touch, and temperature. Each time you receive chemotherapy, your nurse will ask if you are experiencing any tingling or numbness in your fingers or your feet. This helps us assess how the chemotherapy medication you are taking is affecting your sense of touch and feeling. Be aware that not all chemotherapy medications cause this side effect. You can refer to PI sheet 452. The safety measures listed on the sheet will help you stay safe and avoid injury if your fingers are numb or your sense of balance or muscle strength is affected by peripheral neuropathy. Be careful when grasping objects that are sharp, hot, or cold. You may not be able to feel that you have been injured in any way. Avoid falls by moving carefully, using handrails when using stairs, as you may not be able to feel your foot hitting the tread of the step. Use bath mats in the tub and shower, and use non-slip rugs on floors so you can maintain your balance. Wear shoes with rubber soles if possible. If your feet have little feeling in them, you may not notice that you have cut yourself or stubbed your toe. What is cognitive dysfunction? This is also known as chemobrain. It simply is momentarily forgetting how to do simple, everyday things. You may notice some problem concentrating or remembering where you last had something. It is short-term memory loss. It is not unusual to feel this way. You're not going crazy. Sometimes the effects of fatigue, depression, and chemotherapy can cause this to happen. It will go away after your chemotherapy treatment is completed. You may want to use things like making lists, using sticky notes, or your calendar to help you get through this period. Just remember, it does go away. Patients will often report trouble sleeping at night or staying awake during the day. This is known as sleep-wake disturbance. Unfortunately, there is no treatment that is effective. We mention it here so you are aware it is related to your cancer diagnosis or your treatment. Not every cancer patient experiences pain. Most cancer pain can be relieved or controlled. We cannot help you though if you do not let us know you are in pain. If you are on pain medication that is not relieving your pain, or your pain is interfering with your activities of daily living, call your doctor or nurse. Addiction to opioid medication is very rare. Less than 1% of cancer patients requiring opioid medication for pain control will develop an addiction. For preventing constipation, you will be given specific instructions from your nurse or doctor about our laxative protocol. This sheet is included in your folder. Nausea and sleepiness are common in the first 2 to 3 days of taking a pain medication. They will go away on their own. If they do not, please let us know. You can refer to PI sheet 443 on pain. Sexuality and chemotherapy. It is normal for your libido to be affected while you are receiving treatment. Discuss these changes with your partner and healthcare team. Physical changes may include hormonal changes, nausea, changes in appearance, and fatigue. Emotional changes may include anxiety, depression, and mood swings. Chemotherapy can cause birth defects. If you are sexually active, you must protect against pregnancy. If you have sexual intercourse, you must use a latex condom for 48 hours after receiving chemotherapy because a small amount of chemotherapy may be present in semen or vaginal fluids up to 48 hours after chemotherapy. The condom will serve to decrease exposure to body fluids that may have small amounts of chemotherapy in it. Talk to your doctor if you have any questions about sperm banking or egg preservation. You can also refer to PI sheet 437 on sexuality and cancer. Lake Health University Hospitals Seidman Cancer Center has a licensed social worker to help you with your needs during treatment. Our social worker, Kelly DePippo, is available to assist you. You and your family can meet with her to talk about ways you can get assistance if needed. Your concerns can often be matched to available community resources. We can provide assistance with transportation arrangements, financial concerns, disability applications, insurance problems, employment and school issues. Information on area support groups and other types of support services is available as well. Many people initially feel frightened regarding the unknown. This is to be expected. Intense emotions may come and go. Forget any myths you may have heard about chemotherapy. Everyone is different and will experience it differently. It helps to be as prepared as possible for what to expect and keep an open mind. Use this folder as a reference for yourself. If you are experiencing a side effect, look at the information given regarding that side effect. You may want to bring a family member or friend with you for support during a difficult time or just to help distract you. Bringing other things that you enjoy with you can also be helpful, such as a Walkman headset for CDs, books, crossword puzzles, videos, or your laptop. We are wireless here. We are here to help. Please let us know what we can do for you. There are many resources to help you. You will quickly develop a relationship with your nurse and physician. There is a social worker on staff whose sole purpose is to make the experience of dealing with cancer easier for patients and their families. The social worker can help you with practical concerns as well as spiritual and emotional issues. Patients can schedule individual appointments with our social worker or see her in the treatment room while receiving chemotherapy. Other complementary therapies are available, such as support groups and massage therapy. Healing and Hope programs are educational and supportive. They are free of charge. These are programs through university hospitals and are free to all our patients. The Gathering Place is a center with numerous resources for families and patients for anyone touched by cancer. Their phone number is 216-595-9546. You can refer to a couple of PIs, number 442 for anxiety, number 446 for relaxation, and PI 001 for spirituality. There are several websites that the Seidman Cancer Center reviews every 6 months, and we believe that they meet our standards. These sites are geared toward education, not advertisements. We have a Cancer Resource Center in our lobby, which is an affiliation with the American Cancer Society. Please help yourself to any information that relates to the type of cancer you have. If there is something specific you are looking for, please ask any member of our team and they will be happy to assist you or find someone who can. When to call the doctor. Should you require to speak with a physician after hours for any emergency situations, you will call the main phone number of Lake Health University Hospitals Seidman Cancer Center. You will be called by the physician on call. Please realize this may not be your oncologist. Please have information regarding the type of cancer you have, what medication you are receiving, and the date you last received chemotherapy ready to give the physician who returns your call. The main phone number is located at the bottom of the red sheet located in your folder. What to have at home. It is really important to have the following items: a thermometer to take your temperature with. If you need one, please let your nurse know and she will give one to you. Tylenol, Benadryl, Senecot, Imodium. These are to take in the event of fever, itching, constipation, or diarrhea. Fluids. We recommend ginger ale or Jello so that if you become nauseated, you will continue to take fluids to remain hydrated. Gloves. These are for the caregiver. In the event you have an accidental episode of vomiting or diarrhea within 48 hours of your chemotherapy infusion, whomever is cleaning this should wear gloves to avoid any potential exposure to the chemotherapy agent. The phone number to Lake Health University Hospital Seidman Cancer Center, again, is on the bottom of the red sheet. The red sheet lists the items we have discussed that you need to call us for. Please note these calls can be made to the nurse line, which is listed on our staff sheet in the front of your folder. Our goal is to stay on time, but there are times when unavoidable circumstances cause us to run late. We will try to keep you informed of any delays. If you have waited longer than 20 minutes in our lobby, please make sure that you check with the front desk. Our operational hours are 7:30 to 5, Monday through Friday. If you have a lab appointment, lab is drawn every day, 8:30 to 4. Our parking is in the front of our building, and the check-in process is that you just go to the front desk and they will make sure that you get to where you're supposed to go, so that when you come to your chemotherapy, you feel as prepared as you possibly can be. Again, don't be afraid to ask questions. If you have a question that can't wait until your chemotherapy infusion, please feel free to give us a call.